Good afternoon. Bon après-midi à tous. My name is Julie Turcotte, and I will be your moderator for today. Bonjour, je m'appelle Julie Turcotte et je serai votre modératrice aujourd'hui. Thank you for joining us for today's media availability on the novel coronavirus COVID-19. Merci de vous joindre à ce point de presse au sujet du nouveau coronavirus COVID-19 aujourd'hui. To the you who is speaking on Zoom, please put your view on speaker view instead of gallery view. The button for this is located on the top right corner of the Zoom video screen. Veuillez changer votre écran au mode speaker en anglais pour pouvoir mieux voir les porte-paroles. Ce bouton est situé en haut à la droite de votre écran. Reporters with accessibility needs can pin the interpreters, Marie-Jacques and Liz, or follow along on YouTube. Les journalistes ayant des besoins en matière d'accessibilité peuvent épingler les interprètes, Marie-Jacques et Mise, ou suivre la diffusion YouTube. Today, we will be hearing remarks from Dr. Vera Etches, Medical Officer of Health with Ottawa Public Health. Notre porte-parole aujourd'hui sera la Dr. Vera Etches, médecin-chef en santé publique Ottawa. Following remarks, we will take questions from the media. A friendly reminder to please keep your microphone on mute until I invite you to ask your question. Veuillez désactiver votre microphone jusqu'au moment de poser votre question. Je passe maintenant la parole à la Dr. Etches. Dr. Vera Etches, I now turn it over to you.
Merci. Bonjour, Quay. Good afternoon. I want to thank every Ottawa resident who's taken the step to protect themselves and those around them by getting vaccinated. To date, 83% of people in Ottawa aged 12 and over have received at least one dose, and 70% of people 12 and older have received 2 doses. Thank you. Every day, we are getting closer to achieving our goal of fully vaccinating 90% of the eligible population in Ottawa. Chaque jour, nous nous rapprochons un peu plus de notre objectif de vacciner entièrement 90% de la population admissible à Ottawa. Achieving 90% is possible, but we will need to work together as a community. Based on the early survey data we did about COVID vaccination, we know the vast majority, about 82% of people were planning to get a vaccine once it was available. Less than 10% of people indicated they did not plan on getting a vaccine, and about 10% indicated they weren't sure. It's been Ottawa Public Health's job to make sure that everyone has the information they need to make an informed decision about getting vaccinated, and this work will continue. À Santé publique Ottawa, une de nos fonctions est de s'assurer que les gens ont accès à l'information qu'ils nécessitent pour pouvoir prendre une décision éclairée concernant la vaccination. Ce travail important continue. So to get to 90%, Ottawa Public Health is working with partners to address barriers and provide more access to the vaccine to make it as easy as possible for everyone who wants to get one. Community clinics continue, and we're extending now the use of mobile clinics, bringing the vaccine to where people are living, working, playing, and praying. Workplaces, community organizations, places of worship, and other groups can now request a mobile vaccination team to administer first and second doses of the COVID vaccine on site at their location. So any organization wants to request this mobile vaccine, visit ottawapublichealth.ca/COVID-19 vaccine for more information. All health system providers have a part to play to promote vaccination of their patients and clients proactively and as opportunities arise. They can ask if someone is vaccinated. They can advise that vaccination is a recommended protection. They can assist people to make an appointment. And if they are providing the vaccine, they can administer the vaccine on the spot. So it's hard to believe, but we are just 6 weeks away from the first day of school for most Ontario schools. And I'd like to thank again people of Ottawa for your amazing progress on vaccine uptake, especially including children and youth 12 to 17. If you or your child falls within this age group and you have not yet received your first dose of COVID-19, now is the time to do so this week in order to be fully vaccinated with 2 doses before the start of the school year. We're waiting for more details from the province on the school reopening plan, but we anticipate the return of in-person learning. And keeping schools open once students return has been one of Ottawa Public Health's top priorities since the beginning of the pandemic. We know students, their parents, caregivers, and educators benefit mentally, socially, and developmentally from in-person learning. And it's important for workplaces as well to have the support of schools. Nous savons que les élèves, leurs parents, leurs aidants, ainsi que les éducateurs bénéficient tous sur le plan mental et social et du côté du développement et de l'apprentissage en personne. Some families might be feeling uneasy about sending their child or youth back to school. And I want to underline again, we know that transmission of COVID-19 in schools during this past year was low. It was very rare that we ever closed a school. The public health measures in schools ensured that children were as safe as possible for students, so schools were as safe as possible for students and education staff. And we've added to those protections. We know that rates of COVID-19 in the community are what then get reflected into schools. So meaning the more COVID there is in the community, the greater likelihood of it appearing in schools. And so that's why it's good news right now. Our COVID levels are low. And it's why it's so important that we continue to work towards community immunity by getting vaccinated. There are children under 12 who are not eligible yet to receive a vaccine. So now is the time that we can rally and help protect children by getting vaccinated ourselves. Les enfants de moins de 12 ans ne sont pas encore admissibles à recevoir un vaccin. Le moment est donc venu pour nous mobiliser et d'aider à protéger nos enfants en nous faisant vacciner. Change subject slightly, but not entirely. We are closely watching the situation in UK, in Israel, and in other countries where they're currently experiencing a resurgence despite a high vaccine uptake. So many people are wondering if another resurgence is inevitable here in Ottawa. We don't have to follow this trend. In addition to ensuring that we're as fully vaccinated as soon as possible, there are other actions that we can all take to reduce COVID transmission. It includes wearing a mask in closed spaces and crowds, maintaining physical distance from others, and staying home when you're sick, except to get tested, even if you've had 2 doses of the vaccine. En plus de veiller à ce que nous soyons entièrement vaccinés le plus tôt possible, nous pouvons tous prendre d'autres mesures pour réduire le risque de transmission de la COVID-19, y compris le port d'un masque dans les espaces renfermés et dans les foules, le maintien de la distanciation physique par rapport aux autres, et rester à la maison si vous êtes malade, sauf pour aller faire passer un test de dépistage, même si vous avez reçu 2 doses du vaccin. These are public health measures that will continue to reduce the spread of COVID-19 and will likely remain in place for some time. So if you still have questions about the safety of the vaccine or the effectiveness of COVID vaccines, or you simply aren't sure what to do, talk to someone. Talk to your family physician, a family member, or a friend who might have been in a similar situation, or an Ottawa Public Health nurse or team member. They're here to listen, and they'll listen with compassion and empathy. And if you were once hesitant and you changed your mind about getting a COVID-19 vaccine, share your story with others. If you find yourself talking with a friend or a loved one who isn't sure about vaccines, there are ways you can do that without judgment. Engage the person with open-ended questions like, what could I clarify for you? Instead of just yes or no questions. Listen more than you speak. Sometimes people just need a safe space to be heard and get their thoughts out and organized. Avoid belittling or shaming, dismissing or judging someone for being hesitant or having questions. And don't assume what someone's reasons are for being hesitant. Again, start with listening. And then, of course, you can visit our website for more information and for resources. In addition to our vaccine page, we recently updated our community immunity page, which features more helpful information on the importance of getting a vaccine, how to talk with others about vaccines, what to do as we continue to journey towards community immunity, and there's mental health resources and more available. So visit ottawapublichealth.ca/community immunity. We know, as Ottawa Public Health, that the impacts of the pandemic on the well-being of our community continue to be felt. And so our focus is also on plans to stand up and catch up on public health services that promote health, including and beyond vaccination. We are doing this through partnerships with workplaces, educational institutions, Indigenous service providers, the City of Ottawa, and many healthcare providers. We're getting there, Ottawa. You should be proud. Let's stay the course. Thank you, Miigwech. Merci.
Thank you so much, Dr. Etches. I will now invite each media agency in alphabetical order to ask their questions. Please remember you have one question and one follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique. Chacun pourra poser une question ainsi qu'une question de suivi. We will start with CBC Ontario Today. C'est à vous.
Thank you. Thank you for taking my question. I wanted to ask a little bit about what's happening in Alberta. And there's been some discussion about reaching a sort of treating this as a steady state endemic disease and the return to no more quarantine or need for mask mandates, that kind of thing. What do you think the impact of the message there is on how Ottawans, perhaps their impact and questions about our approach versus theirs, and also sort of a definition of what endemic disease means and what steady state means, and whether this applies at this time?
Thank you. I'm not familiar yet. I'm sure we'll catch up on what all the details are in Alberta's plans. What I know is that in Ontario, I do encourage people to follow their local public health unit for the most relevant advice to their jurisdiction. What we imagine an endemic state is for COVID, and that is where we're eventually heading, is that the virus is circulating in the community at a level that's low enough that it's not overwhelming the healthcare system. It's not causing so much severe illness that we have to stretch and cancel other kinds of health services and really work in unsustainable ways to manage. I look at the situation with COVID and it's definitely improving. We absolutely have more protection from severe disease because of the vaccines. But we still have 30% of our population that is not vaccinated, and most of that population is not yet immune either. And that's a large enough population to still have exponential growth. This virus, COVID, has shown us over and over again how it can grow exponentially in an unvaccinated, unimmune population. And it will spill over with high levels in the community to vaccinated populations as well, because the vaccine is not 100% effective. And so we're still at risk of hospitalizations that could put too much pressure on the system. I would say we're not there yet, and you can look around the world and see that masks in particular are a very useful tool to continue to keep transmission lower when you're indoors and in crowded places. And many are having to go backwards and reintroduce masks and as an additional protection while we are still growing immunization levels. So I hope that people in Ottawa will continue with their good practice of using masks and then continue to be vaccinated where they aren't.
Just as a second question, then, what are the if we go into the fall, what is the threshold we need to go into the fall to avoid a spike as we've seen elsewhere with Delta virus? You talk about 90%, but by the time we get into September, where do we really need to be? We won't have the 10%, for instance, for the children under 12. as an example? Where do you think we need to be to avoid a spike?
I think that the vaccination alone, you're right, will probably not be sufficient to ward off a resurgence in the number of people testing positive. Is why I do think that continuing to wear masks will be key. And I think with caution and good practices that we can keep the resurgence from overwhelming hospitals. That would be our goal. We'll keep a close eye on the hospitalizations. This is a period of monitoring. This is a period of assessing this in the real world and building confidence so that then we can relax some of the measures.
Pourriez-vous répéter en français, s'il vous plaît?
Oui, c'est important concernant la possibilité d'une augmentation de la COVID-19 cet automne, de continuer avec d'autres protections, plus de la vaccination, comme le port de masque, parce que c'est une période où on a plus de pression concernant le nombre de personnes à l'intérieur et on a l'utilité des masques. On peut utiliser cette mesure d'éviter, j'espère, la pression sur les hospitalisations, les hôpitaux. C'est clair, c'est probablement l'expérience cet automne d'avoir un plus grand nombre de personnes qui ont un dépistage positif, mais on veut éviter les hospitalisations. Et la protection de la vaccination, c'est clé. Ça aide beaucoup, ça déjà aide les populations plus âgées, plus à risque pour les hospitalisations, mais c'est probablement pas assez pour l'automne. On a besoin de continuer avec caution et évaluer quand on peut diminuer les mesures.
Thank you, Dr. Etches. We will now pass it along to CBC Ottawa. Over to you, please.
Thank you. Hi, Dr. Etches. It's Natalia Goodwin here. Just on the reopening of schools, what would you like to see in that school plan? The science tables paper had a bit of guidance that they would like to see. How would you like to see school look? As strict of measures as was in place this year, or could you see a loosening of some measures?
So for those who aren't following local news as much, my hair is the colors of OPH because I see the opportunity to raise attention and awareness and funds to support children's mental health. It was a campaign locally, and I want to tie this, directly. It's related to the question about schools, and children's mental health is really going to be supported by as much of a return to normal school in person and sustaining that in-person learning as possible. We do need to continue with precautions like masks in schools because children are part of that large unimmunized population when they're below 12. And we then need to monitor how we're doing as a community. If we're able to keep the level of COVID low and not pushing on those hospitalizations going up and causing stress on the system, we'll be able to evaluate and add in more and more. So extracurricular activities are also important to children's socialization and development. They're important to be able to add in. What I'd like to see is an emphasis on outdoor activities as much as possible because we know the risk of transmission outdoors is much less. I really want to see all of us involved in going into the school environment, supporting children, educators, workers, everyone taking on the responsibility to screen daily for symptoms. When I look back over how we managed in schools during the course of this pandemic, there really wasn't much transmission in school. When we identified someone who had tested positive, it was usually an exposure outside of school, but they had come to school symptomatic quite often. And then that posed a risk where we had to send people home to isolate. So I would like to see us do as well as we can to keep that daily screening for symptoms in place. And we've been piloting, adding in supports so that if someone does show up at school and then they develop a symptom, they can go home with a take-home test if accessing a testing center is going to be difficult for them. So adding in some of these supports. We believe the schools have been working with the Ministry of Education to increase and optimize their HVAC systems. We know that it's also important to have the protection of vaccination. So we will be working with every school to think about, are there barriers to vaccination that your school population's experienced? How do we make sure those are addressed before school starts? Very end of August, we expect more of a push as people are coming back and they're thinking, oh, I need to be ready for school. Vaccination's part of that. And I think the other thing we know is that our way of handling exposures in school is changing because of vaccination. So I want everyone to know, if you're vaccinated, even if you're exposed to somebody who's positive in the school environment, you won't have to go home to isolate for 2 weeks. That's a real benefit. So I hope that can encourage people as well to head out this week if you haven't already had your first dose, or head into your second dose. You can walk in to any clinic.
Great, thank you. And just my second question is on the mobile clinics for organizations and workplaces that you mentioned. Do you know what the uptake has been in that since announcing it last week, or around how many places have taken you up on it?
So I don't have an exact number at this point. We can get that for you, but it was something we got calls right away, and many calls. I think right away there were at least 20 different businesses. That would be higher now, and it doesn't just have to be businesses. These can be community associations, and anywhere where people have a site that they'd like to offer to a group of people who may have had barriers to immunizing.
Okay, thank you.
Yeah, so I'm getting an estimate. Somebody sent me a number that's about over 50 right now.
Okay, great, thank you.
Thank you, Natalia. We'll move over to City News Ottawa. Please go ahead.
Hi, Dr. Etches. My question is, you mentioned a while ago that right now is a period of monitoring and, getting needles into arms. But aside from that, how is Ottawa Public Health preparing for a fourth wave?
Our team has been so flexible. I want to thank the Ottawa that's done case and contact management, for instance, that's worked on outbreaks. They have less work actively with people who are testing positive right now, but they're taking the time to have vacation, to get recharged, to work on processes, to improve data, to do more investigation of potential exposure sources and prevent outbreaks. So working with our outbreak team, for instance, is working with long-term care homes and retirement homes to be able to make sure that people maintain the good practices that will keep out residences and workplaces. So we are basically anticipating there could be a resurgence and more demand on those teams, and so we're not scaling back right back to zero. We're making sure that we maintain some capacity. We also know that the types of work we need to do over time vary. So right now we still have a large vaccination campaign underway. We are orienting that more and more to neighborhoods, and so team members are having to remain flexible to work one way and shift if the demand from COVID works in another way. And we're maintaining our surveillance. So, we have people who we're still working on daily reporting. We've discussed whether that needs to be daily at this point, but we know heading into the fall, there'll need to be a close eye on what is happening with COVID in our community. So maintaining our surveillance systems as well.
Okay, thank you. Now just kind of look into, I guess, across the world. We're seeing that Tokyo cases are just spiking right now, and from the world. How worried should we be about the Olympic Games being a global super spreader event? I mean, because we're going to have athletes coming back here in the next few weeks.
Well, we do still have the quarantine processes in place for people who return to the country. We know that's a period where we need to take extra precaution and make sure that people are monitoring for symptoms if they haven't been vaccinated, to be following the quarantine isolation. So these are measures that should assist with the return and any detection of COVID. Do follow up with all travelers who test positive, and it's a very small percentage actually of the COVID that we do detect in the community.
Thank you.
Thank you so much, Eric. We'll move over to CTV Ottawa. Please go ahead.
Hi there. Along the lines of some masks being a useful tool, even going forward for people who are fully vaccinated. I know that this is the Public Health Agency of Canada has some guidelines on when you don't need masks if you're in a group of fully vaccinated people. And with the local bylaw coming to an end, but I'm just curious what you think will be the future of mask use in Ottawa, especially in the fall. You're worried about a resurgence. Are we going to go back to having stronger local mask mandates? Or is this kind of where it's just going to slowly to an end as the virus sort of becomes endemic, as it were?
So we do have in place a local bylaw that supports mask use, but we also have in place a provincial regulation that requires mask use in indoor environments, in crowds, in workplaces. So what I expect going into the fall is that we will continue to operate under provincial regulation, which I'm recommending and speaking with our chief medical officer about, continue to include mask crowds. It is true, we have federal guidance when someone has 2 doses of COVID vaccine and they're gathering with other people who have 2 doses, that masks aren't required when people feel comfortable in that situation, if they don't have significant underlying health concerns. The challenge is often we don't know the immunization status of others in the workplace or others in a crowd. So that's why there's still is that rationale as a way to go indoors and monitor, for a period of time. It won't be forever until we can see that we're able to manage the COVID situation.
And is that, and then my follow-up to that then I guess would naturally be in terms of monitoring the COVID situation and keeping a closer eye on hospitalizations in the city. Is that going to be where you kind of fall in terms of recommending stronger measures or looser measures by keeping an eye on those situations, people healthcare capacity versus overall case counts? Is that kind of where you're shifting your focus?
I think that's fair. We've always throughout the pandemic tried to use multiple measures to help us understand what's happening. So I think you wouldn't be surprised in my answer today. I'm not going to say it's only hospitalization. Look global picture. How quickly is COVID growing? Are we seeing something that's exponential that will lead us into danger territory? We have the wastewater, which again, credit to Ottawans right now, it's pretty stable. You're holding it together, keeping it steady as she goes. So we'll look at all of these things, but you are right to question relying on cases or people testing positive alone. That isn't the same kind of indicator of concern necessarily as before. The risk of hospitalization is not as closely tied to that rise in people testing positive because of vaccination. However, there is still a link. So we need to watch multiple aspects and absolutely be thinking about the hospitalization.
Thank you, Ted. We'll move over to global news. Please go ahead.
Hi, Dr. Etches. So you mentioned that you were speaking to the Chief Medical Officer of Health about keeping mask mandates once we lift more restrictions. Are there any other current restrictions in say the stage 3 reopening that we're in right now you'd like to see kept on, like distancing between tables in restaurants or anything like that?
I think what we're operating under is the provincial framework where we're in stage 3, and I anticipate that some of those measures will be relaxed as stage 3 comes to an end, and that gives us the opportunity to monitor again before school starts, before more people return to the office or in-person work, a period of time, see if we're still able to hold things steady. And so it's a little premature for me to know what will be required at that point. And distancing helps as well when you're not sure if you're in an environment of immunized or unimmunized and what the risk may be.
Switching over to vaccinations, you said the 90% goal is still very much achievable, but is this the general pace that you had expected things to move at, where we hit this period heading into August and the fall, or is this slower than you had been expecting?
I'm very pleased at how many people in Ottawa have come out to be vaccinated, not just once, but twice. We're really just above what the polling told us would be the population that wanted to be vaccinated as soon as it was available. I mentioned 82%, we're at 83%. So yes, now we're working through a group who weren't sure. And it does take more time to have those conversations with people. But it's not just people who weren't sure, who need their questions answered. There are still real barriers for some. We've talked to people who aren't immunized yet. We're trying to understand what those barriers are, and they have been childcare. There's still transportation. It's why we're going out more and more with the mobile options and coming when people are requesting us to come, so that it can be convenient as possible.
Thank you very much.
Thank you, Craig. We'll move over to On the City from the Burbs. It appears we may have lost you. If that's the case, please don't hesitate to send us your question to our media relations team. Our apologies for that. We'll pass it over to the Ottawa Citizen. Please go ahead.
Hi, thanks very much. Dr. Hutchins, this is just kind of going over some of this territory, but in a couple of weeks, Ottawa should qualify to move out of step 3 with 75% having 2 doses. The Premier said this week that means most public health measures would go. So what I'm trying to be clear on, are you talking to the medical officer of health about maintaining a mask mandate after the end of stage 3 for everyone, or is it up to individual public health units and you then to put that in place here?
My recommendation would be to have a province-wide approach. And that has been what we're following in the reopening plan. It's provincial direction, province-wide, knowing that we're all connected and that travel is increasing as people have that protection. So I think this is one of the things that's probably under active conversation and consideration for the next step.
Okay, and is that just masks, or are there other public health measures that you think need to remain in place at the end of, after we're out of step 3?
I think this is part of what we need to monitor, and assess which are the measures that are going to make the most difference and the right balance as we go into the fall. And so I think I'm not part of the public health measures table, but I know the science table and the public health measures table have been looking at the evidence and the international experience around what is worth maintaining. And clearly, I think masks stand out as one of the practices that is clearly helpful.
Thank you. Thank you, Elizabeth.
Yeah.
We will now pass it along to Ottawa Sun. Please go ahead.
Hi, Dr. Etches. It's Aidan Helmer from the Ottawa Sun. You had mentioned earlier a concerning resurgence in cases in other parts of the world. I'm just particularly concerned, I guess, with the Delta variant. Quebec has mentioned just recently that they're expecting a Delta wave, and we have seen some spikes in those particular numbers in other regions of Ontario. Just wondering if you can assess sort of what the level of concern or the level of the threat of the Delta variant is here in Ottawa.
So we do monitor for this in terms of the percentage of all the people who test positive for COVID, what percentage come back as variants and which type of variants. There's a lag in time to determine whether we are detecting Delta or not, but it doesn't appear to be the majority variant in Ottawa. We still seem to have the Alpha variant as the predominant type of COVID in Ottawa right now. That said, Delta is more transmissible. If it takes root here, it could easily be introduced from other parts of that could change into the future. I would not be surprised.
And just as a follow-up, I'm wondering if I could ask, there has been some recent data on breakthrough cases that are associated with the Delta variant. Our vaccination rates are very high here in Ottawa, but again, how concerning should that be to those who have already been vaccinated?
I think if people who have 2 doses of vaccine against COVID have good protection against hospitalization or death due to, including from protection from the Delta variant. So it is important to get the 2 doses. So we can take the opportunity to speak to people who have only their first dose, to call on people, especially age 18 to 39. Don't miss out on the opportunity for having that second dose, because that does make a difference in terms of protection against the Delta variant.
That's great. Thank you. Thank you, Aidan. On va passer la parole maintenant à nos collègues à Radio-Canada, Ottawa. C'est à vous, s'il vous plaît.
Bonjour, Dr. D'abord, moi, j'aimerais savoir que la campagne de vaccination, comment est-ce que le taux de vaccination à Ottawa va changer le retour à l'école? Vous l'avez dit un peu plus tôt. Il y a beaucoup de jeunes qui ne sont pas vaccinés, tout d'abord parce qu'ils ont en bas de 12 ans et qu'ils n'ont pas de vaccin accessible pour eux. Mais comment est-ce que la vaccination en tant que telle va se traduire dans le retour à l'école?
Oui, merci. Nous avons les méthodes de prévenir COVID-19 dans les écoles, et la vaccination augmente notre confiance qu'on peut contrôler la transmission de COVID-19 dans les écoles, parce que les éducateurs, éducatrices, les jeunes qui ont plus de 12 ans sont pour la majorité protégés par le vaccin. Alors, ça peut donner confiance, et c'est aussi, on va procéder étape par étape, mais on peut imaginer un grand retour aux activités sociales ou dehors les écoles avec cette protection.
Merci. Est-ce que vous appréhendez l'arrivée d'une 4e vague à Ottawa malgré le fait qu'une bonne partie de la population est vaccinée et compte tenu du fait que vous espérez qu'il y ait jusqu'à 90% des personnes qui soient vaccinées, idéalement? Oui,
c'est possible d'avoir une augmentation dans le niveau de COVID dans notre communauté, parce que c'est 30% de la population qui ne sont pas vaccinés. Alors, c'est possible encore. On veut continuer avec le cible de 90%, mais même si il faut utiliser d'autres mesures de réduire la transmission de COVID-19, comme le port des masques, pour cette période, juste en automne, pour donner le temps d'évaluer l'impact de plus des gens à l'intérieur ensemble. Et on peut peut-être changer l'approche après on a plus d'informations.
Merci.
Merci, Emmanuel. Nous allons passer à TVA Gatineau-Ottawa. C'est à vous.
Je peux juste peut-être prendre cette pause d'ajouter quelque chose concernant l'impact des vaccinations dans les écoles, parce qu'il y a une différence maintenant aussi pour les gens vaccinés. Ils peuvent rester dans les écoles après une exposition, on dit, quand quelqu'un a un dépistage positif pour COVID-19, peut-être dans la cohorte. Les gens vaccinés peuvent rester dans les écoles. Il n'y a pas une politique maintenant pour isolation pour 14 jours après une exposition comme ça. Ça, c'est aussi un bénéfice.
Merci beaucoup, Dr. Etchez. Pour TVA Gatineau-Ottawa, je pense qu'on vous a possiblement perdu. S'il vous plaît, nous envoyer vos questions à nos par courriel aux relations des médias. Et juste pour vérifier, je crois qu'on avait possiblement une dernière question de Arab News. Et encore une fois, si vous voulez nous envoyer cette question-là par courriel, ça serait apprécié.